Hi, this is Paul Feuerstein, Technology Editor of Dentistry Today, and it's my great pleasure to be here with my friend Robert Gottlander. Robert, how are you today?
I'm good, Paul. How are you?
Robert is the Vice President of Global Prosthetic Solutions at Henry Schein, and we've actually completed a fabulous project called ConnectDental. And in a nutshell, what we're trying to do, I say we, in the whole industry, Henry Schein specifically, is trying to demystify the technology that should be in every dental practice. And explain a little bit about the concept of what's going on here.
We've been working with this now for 3-4 years. We looked at the technology that is available, and as you know, that we work with open architecture. We work with different kinds of technology. But we found is that one have to add also the, let's say, the assessment of the practice, the assessment of the laboratory, to make sure that the dentist can get the right solutions for that specific practice.
Well, it's confusing as a GP to come on and say, should I buy this machine or that machine? And I think what you're doing is taking that machine out of the picture and saying, here is your total solution to the problem.
So what we do, we work very closely with the dentist to understand what is their need and what's the need of their patients. And then to make sure that we can, together with the dentist, to define the need, and based on that, what would be the best end-to-end solution? What would be the best product for the practice?
And so does Schein have sort of an analysis of the practice that they do, or how does the
Yeah,
whole
no,
thing?
we have a structured analysis that we have been developing. We have had it for some time for other kinds of solutions, but we now also added the digital solutions to it. And we not only talk about the solution, but also to make sure that what kind of education would you need? How do we get the staff involved? How can we integrate this into your current business model?
So there's obviously training involved too.
Big part is training. As we all know with new technology, that you get enthusiastic about the technology, you would like to get started, but then you need to know, okay, how do I get started? What do I have to do in my practice to be sure I can make it work? Because it's an investment that you have to do.
But I'm looking around in the ConnectDental system here, and you have scanning, you have software, you have cone beam, you have laboratory aspects of it, and it's a little bit overwhelming if I'm sitting here as a GP and saying, how do I put this all together? I mean, I guess the analogy, which we've talked about in the past, is that if I buy a brand new automobile with all the fancy anti-this and anti-that, do I really care how that all works, or do I just push that button and say, let's go?
You go to someone, you talk to someone where you have trust.
Uh-huh.
You know, we would like to think that ConnectDental is the trusted digital solution that can give you the advice and to say, okay, if you press that button, this is what you get. And I will make sure that we can make it work for you. In a little bit the same way as you say about an automobile, you don't need to know how the technology is working, but what you need to understand is how does it work for me when I'm driving it.
And I also want to work with a company that will, as you said, I can trust to call on the phone, come on over, help me out, do whatever you have to do to make this thing all work.
And what we have seen also over the years now, when we really have been focusing on this, is that with all new technology, it's new today, but in 2 to 3 years' time, there might be some upgrade of that technology. So you also have to choose a partner that you can work with to develop going into the future, because it's a journey that you are starting. When you decide to enter new technology, you enter a journey. And you need to have a partner that you can work with. And also that you can make sure that you can get, let's say, the education, the service, the support, not only today, but also in the coming 3 to 5 years going forward. Because what we all know is that the change is going quick, but it will not go slower in the coming years.
And I also wouldn't have to monitor it all myself and say, oh, I hope I get this new aspect when it comes out, this new integration when it comes out, that this whole system would be watching over me, I said, in a sense.
Yeah, and that's really what we would like to be, as to be the trusted partner to the profession, is to make sure that we can work with, the technology aspects, the education aspects, the service aspects, and the profession can do what the profession does best, and that is to treat patients.
So I think in terms, let's just talk about the intraoral scanners. I think the dentists get too hung up on this one's faster, this one's slower, this one does this one does that. I don't think that's actually that important. At that piece, how does that work in the flow of the office is more important.
I think today, if you take a step back and not discuss technology so much, but talk regular impression material, they have different setting times as well,
Sure.
right?
Yeah.
So it means that I think sometimes that we, with new technology, we're discussing topics that are important, but it not might be the only thing to discuss. Because it really is about the whole workflow. How
Yeah.
does it work in my practice?
Right, and I think again that we want to not get hung up on these pieces, and really look at the overall flow. I think that's the whole. To me, that seems to be the message I'm getting from you.
Yeah, and that's what we have found, both working with customers and working internally, is that the whole flow is important. And we should not forget also part of the hub. I mean, we talk about, they say, the different stages in the treatment of the patient. But one thing that we sometimes not talk about is the practice management component. What kind of administration system do you work with in the practice?
And you want to have a convergence of everything.
You want to have a convergence of everything into that, because in some way that is the hub of how you, in the practice, is directing your treatment. So it means that all of the different components have to talk to each other.
And obviously, office-centered and certainly patient-centered as the end result of this whole thing.
Absolutely.
Well, this is called ConnectDental. It's a new project from Henry Schein. It looks really terrific. I think it's going to demystify everything for everybody out here. Well, where can the dentists get more information? Obviously, they can talk to their local Henry Schein representative.
And they can talk to the representative, they can go to the website, and we are happy to support in any way we can.
This is quite an initiative. I think this is a great idea, Robert. Thank you so much for your time.
Thank you, Paul.
And it's always been a pleasure. Thanks so much.
Thank you.